Well, good Monday morning to you, and welcome to our Monday morning live edition of Healthy Living South Mississippi. Live healthy, be healthy. I'm Jim Tabor, along with Doctors Jim and Janine Fox of Doctors Nutrition.
Morning.
Our phone lines are 896-0713, 800-349-0713. If you have a question regarding today's topic or anything in particular, you're welcome to give us a call. You can either ask them personally or just pass the question along to our operator. So, tomorrow's the day of love, so to speak.
Valentine's Day.
Right.
So we decided that we would talk about the heart.
Yeah, and it's also National Heart Month.
Yes.
So because it was National Heart Month and the day before Valentine's Day, we thought heart would be a good subject to talk about.
Well,
it's such an important one, too.
I was going to say, it's kind of a key part of the body there.
It's like, working properly.
Exactly. If it's not working properly, you need to do something about it.
Because, you're in trouble. That's right.
Yes, this is true. And a lot of different things that you can do and to really help out. I mean, one of the things that I was out a mile and a half on the track this morning.
Right.
Yeah, exercise is really good for the heart, but you got to make sure you're taking the right kind of nutrients too. That's real important for heart health, And what we'd like to focus on is testing for the heart. I mean, there's certain tests that are not done routinely and really need to be, because we're seeing more and more problems earlier and earlier and earlier. I mean, we're seeing the 20s and 30-year-olds now with metabolic syndrome, actually seeing teenagers with metabolic syndrome. And that's, when you have that metabolic syndrome, one of the consequences is cardiovascular damage. And you start damaging it, and you don't really know it until it's too late.
And the cardiovascular damage they're finding is probably starting in people's teenage years. It's not really starting, it accelerates as you get older, and of course, the more years you have that damage, the more problem you can have and the more heart disease you can have. But we wanted to stress that really just checking cholesterol does not tell you where you are on heart health, because everybody thinks, well, I got my cholesterol checked, it's fine. That is only one little bitty factor. I mean, it's not the biggest factor in heart health. I mean, you can have perfect cholesterol and still have a heart problem.
Well, your blood pressure has something to do with that.
Actually, the metabolic syndrome that he talked about, one of the factors that goes with it is high blood pressure. And if you look at if they look at all these factors tell you have high blood pressure is one of them. If you have high blood pressure, you're likely to have metabolic syndrome. Not everybody, but it is a possibility. And there's no doubt that people say, oh, my blood pressure's just been a little high, it's no big deal, it's been like that for years. But a lot of people don't realize that long-term high blood pressure can cause enlargement of the heart. Yeah. And then when you start getting an enlargement of that heart, then you start having other problems associated with that.
Yeah, it starts not functioning properly, and we get into so many problems nowadays that we're seeing, like I say, we're seeing younger and younger and younger people having this metabolic syndrome and
high blood pressure.
High blood pressure and so on. You get all these things, weight gain around the middle and all that. That's the tendency to have the underlying problems that are going to cause heart disease. And, that is the problem, not cholesterol.
Right. One thing we like to stress is prevention.
Right.
Don't wait until you get older and you do have a problem. Don't wait until you fall out. Don't wait until you have a problem. Know your underlying factors, and then you can do something about it before it becomes a bigger issue.
Well, I was in my 40s when I found out that I had, high blood pressure. Up until that point, I thought, it was like textbook normal, 120/80 all the time, 120/80, right in there. Then one day I went to the doctor and it was like 150/90, and it's like, whoa, where did this come from?
Well, you also have that metabolic syndrome.
Exactly.
I mean, we've actually found that when we started doing the testing on you a few years back when we started the show. And so that's probably was back then. It probably started back in your 40s.
It did.
Oh, it started earlier than that. The damage started earlier than that. It just kind of manifested itself in your 40s. That's when it finally started showing signs that you could see.
Between that and and high cholesterol, so that's of course.
Well, the body makes cholesterol in response to something going on that's not right. When something's not correct in the body, it's when there's damage and so on. It uses cholesterol to kind of patch things, for instance. And if the cardiovascular system is damaged, then it puts cholesterol in there, uses that as, if you will, a patch. And so that's when cholesterol becomes a problem.
But
we
too many patches make a problem.
Yeah, I mean, when you got too many patches, if you take a tire, you patch it too many times, it's kind of gone. It's the same thing with your heart and cardiovascular system.
Now, you definitely have to stay up on that all the time. As far as any kind of things that you can do for heart health. And exercise does help.
We always talk about diet and exercise. I mean, that's always, that's a given.
Yeah. Well, you're talking about how it seems like earlier and earlier in life now people are having problems. Well, look at again, and we talk about this every week because it has so much to do with it. Is look at the lifestyles that people have changed. Look at the food
Yep.
that they're eating and the processed food.
Yeah.
Right.
And a lot of that's going to lend to it.
And
Yeah.
sugar. Sugar is what actually causes metabolic syndrome.
Okay.
And, metabolic syndrome is probably one of the biggest causes of heart disease.
All right. Well, we got a phone call. Connie from Mobile on the phone this morning. Good morning, Connie.
Good morning. How are you?
We're fine. What's
How
your
are you?
question for the doctors?
Okay. My question is, my husband is a big guy. He's strong. He's muscular, but he comes from a family that did a lot of starches and the good old soul food and all that. And I was trying to give us a healthier diet. Well, he got sick and he was diagnosed with having an enlarged heart.
Mm-hmm.
I've been trying to change his diet, which got his blood pressure and stuff down, but I cannot get him to stop smoking. And he's saying that my heart doesn't give me trouble. I don't feel any pain from my heart. But we were trying to tell him you don't have to feel it in order for something
You're
to
right.
go wrong.
You
You're
know,
absolutely right.
a lot of times, Connie, people don't feel it until they're laying in the emergency room with an IV in both arms. That's
Yeah.
the sad part. You know, I mean, you
And
really don't
sometimes
notice
they
it.
don't make it to the emergency room.
Right.
The real bad part is people that have what they call sudden cardiac death.
Yeah.
And so a lot of times you don't have any symptoms. Symptoms are your last ditch for the body to say something's wrong, you're not paying attention. So just because you don't have symptoms, you're right. It doesn't mean there's not a problem. And if he's had an enlarged heart, my guess is he probably had high blood pressure for years. And
Yes,
maybe
and
didn't
it kind
even
of runs in the family.
Right.
They're big
Yeah.
guys, and they were saying that his heart was too large for the cavity or something. It's really big.
Yeah.
But I just can't get him to understand. Look, there are things you can do to help this situation.
You're right. You're right.
You just don't have to accept it.
How old is he?
I was going to say,
Yeah,
He's 63. He's 63 now.
Okay,
53.
And
Did you say
yeah,
5'3"?
6'3".
6'3".
6'3". Oh, okay.
Yeah, 6'3".
Still a young guy.
yeah, really.
Yeah.
And so, yeah, I mean, unfortunately, you can tell people all day long, but until they want to change, it's hard for you to make him, even with you living with him. And
Perhaps a Louisville Slugger.
but it is hard sometimes because I have people all the time that come in and they say, they have a family member that really needs to make some changes, but they won't do it. And I said, well, unfortunately, it's hard to make somebody do something.
Yeah, you're doing everything you can.
And
really.
maybe bring him in, let us talk to him, let's tell him the risk. I mean, that's always something because we get a lot of people from Mobile.
We do.
You can come in, there's no charge for consultation, so you can bring him in, talk to him, bring his most current lab work, and we'll see, if we can talk to him and maybe get through to him.
Yeah.
Okay.
Okay.
I appreciate you so much.
Okay,
Oh,
thank
thank
you.
you.
All right, we're focusing on heart health, so give us a call. We're here live, and we want you to hear from you about any health-related question you have. 896-0713 or 800-349-0713. We'll be right back. And welcome back to our Monday morning live edition of Healthy Living South Mississippi. Live healthy, be healthy. We're talking about heart health, as this is National Heart Health Month. And I mean, you were saying off camera
Right,
that
because our last caller was talking about her husband not having any
Yeah.
symptoms, so he really didn't want to pay attention to it, and then he made a comment.
My comment, this is off camera, but we'll do it on camera now because I think it might help the lady with her husband. I have had two older brothers. One was 53 and one was 58, and the first and only symptom they had with heart disease was death.
Yep, they had their first heart attack and just was instantly
so
dead.
sorry.
Dead.
And so they couldn't even be treated. They didn't even get a chance to go
No.
to the emergency room, nothing. So his family, really bad heart disease, which is
not good.
actually why he is so strict on his diet, because he did, like he told me, he decided in his early young ages, his brothers were quite a few years older than him, that he didn't want to be like them.
That's true.
He didn't want to drop dead. So that's why he is so strict and stays thin, because everybody always says, man, he's so thin. I'm like, he has to work at it because the rest of his family is not.
No.
So he does not come from a thin family, and you can still overcome your genetics. We talk about that a lot.
Yeah, that's the genetics
Yeah.
part of it. My family genetics is, probably like your husband's not good. Or the lady that called it, her husband was not good. So he's got some issues going on there. And that's the genetic side of it. But there's something called epigenetics, and that's what you do to help alter your underlying genetics, what we call express those genes a little bit better. You don't have to express them in the way of,
Right, and that's why we do stress. We were talking a minute about knowing the factors and doing prevention. Things that we like to check, and we do have something called the expanded cardiac panel.
Right.
And I mean, it does a lot of different tests, but some of the specific cardiac, it does something called homocysteine. Homocysteine is something else that runs in families, and we've talked about it before, but it can be anybody. Exercise and diet does not help homocysteine.
Actually, exercise makes it worse.
Exercise makes it worse if you have that genetic factor. But there's ways that you can lower it. That's why we say if you know that it's there, there's something you can do, because you can actually definitely, there's supplements you can take. And for homocysteine, they've never found a drug other than vitamins that actually lower it. But there are things that you can do to lower it. So if you know the factors, you can actually lower things to prevent. Another one is a C-reactive protein.
Yeah, C-reactive protein is a marker for inflammation, and there's one that's called the high sensitivity, or HS-CRP, which is the real high sensitivity, and they kind of call it the cardiac CRP because it's very specific, because the inflammation going on at the level of the heart and the blood vessels is usually very low compared to the rest of the body, and so you have to have a real sensitive test to do it, and that HS-CRP will find that. And it's one of the biggest predictors. Matter of fact, if you go to Cleveland Heart and places like that, they're going to tell you they're always going to tell you that that's one of the biggest predictors for cardiovascular
They'll tell you
disease.
if you're at low risk, average risk, or high risk for cardiovascular disease. Is one that it'll actually say that right on the lab, the results. It'll tell you exactly that. And so those are two things. Checking magnesium levels is another thing, because magnesium is a big factor in blood pressure. So there's so many things that you can do. Thyroid problems affect cholesterol, which can affect the heart. So even some other underlying problems. Cortisol, the stress hormone, is terrible for damaging the inside lining of the arteries.
Yeah,
it's a really bad hormone when it gets too high. You have to have some, but when it gets elevated, which a lot of people do due to stress, when you hear stress will give you a heart attack, well, that's one reason why.
And it's the same thing with insulin. And part of that test is, when we evaluate you for blood sugar, we don't just look at your fasting blood sugar because, that's only one parameter. We do that, then we do the hemoglobin A1C. And those of you who've been around a diabetic, you understand that that's the 90-day average of blood sugar, so you get an average. Then we look at your insulin production, fasting, and you see how much insulin you're producing to keep your blood sugar where it is. And we see an awful lot of folks, this is a pattern that we see, they've got fairly normal fasting blood sugar. So you would be told if you just did a common little test, oh, you're fine. Then we do the A1C. Now the A1C might be in the pre-diabetic range, not quite diabetic yet, but pre. And then we look at that insulin, and that insil's sky high. And that's telling, we see that a tremendous amount, way too much. And insulin, I had an old biochem teacher, and he said you have to visualize things. And Janine's always having issues with that, so I just can't see that. But when you look at and visualizing a molecule of insulin, he said, think of it sort of like, it's like it and homocysteine are like barbed wire. It's because it has to attach to so many different places.
And it's going to prick things up.
Yeah, it's going to mess things up.
And when you start making those little pricks in the arteries is when the cholesterol and the particles come and lay it down to protect it. And that's when you start building plaque.
Yeah.
So when we do our expanded cardiac panel, we check all that. All that is on the expanded cardiac panel. Now, unfortunately, when you just go for your Healthy You every year, very little is done. And most of the time it's because insurance companies aren't going to just check everything for wellness. They're not there for wellness, they're there for illness. I always say wellness is your job. Wellness is something that it's an investment in your health and that you need to do so you know the factors, so you know if there's something you need to be doing about it.
Exactly. And when we talk about an investment, if you go out and buy a stock or something, and I still haven't figured that one out. But if you do that, you're hopefully you're investing for down the road. Well, the same thing with health. If you try to stay healthy, then you get your insurance to kind of hedge your bet, so to speak.
Yeah.
So if you do get sick, hey, they'll step in.
All right, Sandy from Pass Christian on the phone with a question. Good morning, Sandy. What's your question for the doctors?
Good morning.
Good morning.
My granddad on my mother's side and my mother and my only sister died with a massive heart attack.
Okay.
Ooh.
And I was just wondering what y'all had that I probably need to do.
You're
and
definitely
what the cost of it is.
Okay, you're one that definitely needs to do that expanded cardiac panel because you want to find the the homocysteine is definitely a genetic factor. And the expanded cardiac panel, we have two different ones. We have the one that's 230 that does do the homocysteine, C-reactive protein, does do magnesium, it does everything, but on the lipids, it does a regular lipid test. If we add what we call the NMR, which looks at particles, and particles are more important on who's going to have a problem with them, and I believe it is
265 or something?
No, it's like 295, I want to say. Or 290, 295. But it does a lot of tests. That one test that's called the NMR, which does the particles, it actually can be billed to insurance for like $900 to $1,000, which is why most insurance denies it. It's an MRI of the blood, so it's a really advanced test, and we do it very inexpensive for the kind of test that it is.
Yeah.
So we do recommend that. When you have that cardiac history, which is similar to his,
Exactly.
then you definitely want to check some extra things, even if they're saying, oh, you're okay.
And well, the thing you got to do is, you kind of started off saying, okay, what can I take, right? Mm-hmm. Yeah, okay, well, here's the thing you do. Don't take anything until you know what you need to take.
Right.
Then that's where this test comes in and says, okay, now we've done the test on Christine. Okay, now we know what she needs to focus on. And that way you're putting your money where it needs to be and not just spending it on something that maybe you don't need.
Yeah, some people just go out and take supplements that are for cardiovascular, and they're not going to hurt, but if you're not getting the right thing, then it's not maybe going to help you. And so you might spend $100 a month on stuff you don't need, where if you just did the testing, you might know exactly what you need.
Exactly.
All right. Sandy, and I understand you're visiting from Brandon, Mississippi?
Yes, sir.
Okay, well,
okay,
the doctor's offices are located on Cowan Road in Gulfport, and if you're in Pass Christian, staying in Pass Christian, you can take Highway 90 to into Gulfport, and then once you get to Cowan Road, you'll go north and go across the tracks, and they're going to be up there on your right-hand side.
And we're not far from the beach at all.
No.
Yes, definitely.
Do you have to make an appointment?
No, you don't. And we're there, like today, we'll be there from 10 to 5:30. Me and my husband, we're there Monday, Tuesday, and Thursday, and then Dr. Bull's there Monday through Friday. So we have doctors there, all week.
Every day.
Monday through Friday from 10 to 5:30.
And we have a lot of folks in Sandy, in the Brandon area that we ship things to.
We do.
We talk to them on the phone. Some of them frequently, because they call with questions, especially about diet, things like that. So, feel free to join in that way too. We're glad to have you be part of the family.
We get a lot of people that visit here, visit relatives, and they live around the Jackson area. So, anytime.
Thank you, Sandy, for your call. 896-0713, 800-349-0713. Those are our phone numbers. We'll be back with this week's special and our final cut-in just a moment. And welcome back to our show this morning. Andre from Pass Christian is on the phone now with a question. Good morning. How are you this morning?
I'm doing fine. How are y'all?
Good.
Very good. What is your question for the doctors?
Great. My mother is 86 years old, and she's been diagnosed with Alzheimer's. And I'm under the understanding that I can have a blood test and see if I have the active gene or not. Do y'all provide this service, and is that right?
Yes, we do. There's a couple things. Even the test that we talked about, the homocysteine that affects cardiac health, also high homocysteine contributes and can increase the risk of Alzheimer's because it damages the arteries in the brain. So that's one that we definitely do. And then the APOE
is probably
genotype
the one
is one of the ones that. Now it doesn't tell you everybody that has it. Unfortunately, not everybody shows the genetic factors, even if it runs in the family. Because I think a lot of people are misdiagnosed with Alzheimer's, to be honest with you. I think a lot of it's senile dementia, and that doesn't always show up on these genotype tests, but we do those.
Yes.
So we do the test.
And there is a scan that they said that you can take also.
Right.
And what is the name of that scan?
Usually they do an MRI to actually look for plaquing in the brain. There's something called beta amyloid plaque that actually, when more plaque you have built up, the more likely you're going to have Alzheimer's. And so that's more done. It's
going to be in a hospital
we don't
setting,
normally do that one. You can talk to your doctor and maybe get that done. But we do the blood test.
When you start looking at all these things, Andre, you want to look at, we just talked about this expanded cardiac panel. That checks in your blood sugar, because there's even a lot of the researchers out there now in the field of Alzheimer's call it diabetes type 3. Okay, type 2 is the kind of the diabetes of the common person, so to speak. But they're actually calling it diabetes of the brain or diabetes type 3. And so blood sugar is extraordinarily important. And believe it or not, we start seeing some damage even when things are what's called normal. So you have to be below normal or better than normal.
And another thing that just recent studies have shown is that B12, they took normal people that fall in range on B12. Okay, everybody had normal B12 levels, and they did MRIs of the brain. And they found that if you're on the low end of normal, you tend to have your brain shrink as you get older, which does increase the risk of dementia and Alzheimer's. So B12 is something that you want checked, and you want to keep it on the high end of normal. You don't want to keep it just in range.
Right.
So in other words, you're telling me that you can take my blood and determine if I have an active cell.
Right. Well, what you can tell is is the homocysteine elevated, which increases your chances, but you can change that. You can check the B12 levels, and the APO genotype is one that they're really linking strongly to.
Yeah, it's the apolipoprotein E, or APOE. And that's one that they've, certain genotypes in that family, the four fours, actually have a strong history of developing Alzheimer's and other cardiovascular problems too.
But just because the genes show it and the factors show it does not mean you have to have it, but you would want to do more prevention.
Just tells you what you need to do to prevent.
You would want to do way more
right.
prevention if you actually did have those factors.
Right.
Okay. Well,
Okay.
I'll call y'all after the show. To
Okay.
All right, great.
Sounds good.
Thanks.
Thank you.
Thank you very much for your call. 896-0713, 800-349-0713. We have a few minutes left in the show for your questions. What's the specials for the week?
Oh, well, talking about the heart, the two biggies for the heart this week, the coenzyme Q10, everybody's heard about CoQ10, but we have one, it's called CoQ10/DMG because of the dimethylglycine with it. And it's 300 milligrams per chewable tab. You've tried those.
Yes,
It tastes
yes.
pretty
They
good,
taste
right?
good.
They really do.
Really do.
You always kind of concern yourself about eating the chewables, but yeah, they got a nice little citrusy taste to them.
Citrusy taste, right.
They're very good.
And then, of course, we've got the vascular support BP, and it's kind of a formula that we put together to help a lot of the underlying problems that cause hypertension or high blood pressure.
And it also helps the elasticity of the arteries,
Right.
which when the arteries get stiff as you age is one reason why a lot of people get high blood pressure is because they don't give anymore. So the stuff in that product helps with the elasticity of the arteries as well. So we got both of those. And
Sure
one thing
did.
we didn't even get to today is just talking about how so many medications deplete CoQ10. So we want to
Yes.
real quick talk about that because it's such a factor. Your heart is a muscle. Your muscle has to have cellular energy in order to work. So whether it's your heart or your other muscles, when CoQ10 is depleted, you're affecting that greatly. And the classes of drugs that are known to deplete CoQ10 are beta blockers, which is blood pressure medicine, statin drugs, which is for cholesterol, antidepressants, which y'all all know what that is, and even a lot of the diabetic medications. So there's a lot of drugs out there that a lot of people are taking that are depleting your CoQ10, so just make sure you replace your CoQ10 when you're taking them.
All right, Dorothy from Socia has got a question for us this morning. Good morning, Dorothy. What's your question for the doctors?
I'd like to know why the doctors are putting people on blood thinners and not just an aspirin.
Well, it depends on what the underlying condition is. I mean, if you got something like AFib, the aspirin's probably not going to be strong enough, if you will, or to keep down the clotting. If you've got normal heart rhythm, the aspirin's a pretty good defensive mechanism,
Yeah,
if
it
you
just
will.
really depends because if somebody's had a stent put in, the studies show that you have to have a little bit something stronger than aspirin for that.
Right.
If it's, like I said, if it's AFib, if you have a mechanical heart valve, you have to take a much stronger one.
Yeah.
So it just depends. Everybody's different.
Every situation's a little bit
exactly.
different,
So that's a hard one to answer. Because they do, I guess what I should say is the baby aspirin that you're talking about is just for your regular everyday person that just wants a little bit of thinning because you don't want your blood to get thick. But when
Right.
there's a medical condition underlying, you have to look at that condition and then base what you do on that.
Exactly.
All right, we've got a minute left. Bert from Long Beach, you got a question real quick for the doctors?
Yes. I just recently, you talking about inflammation in your blood vessels in your body. I just recently started taking cumin, black seed, organic oils, and I just wanted your input on that.
Now, it's taking cumin?
Now, curcumins, right?
Curcumin.
Yes.
Yes.
Oh, okay.
Great anti-inflammatory.
Great.
And lysine is another good one that's been shown to be good for the heart. A lot of nutrients are good for the heart. We might talk some more about them next week since we're running out of time.
Yeah.
But the curcumin's great anti-inflammatory.
Really
helps
good-
with
really
heart
good.
health, helps lower that C-reactive protein that we talked about, helps joints, brain, everything.
Yeah.
All right, thank you very much, Bert, for your call. Next week,
We're talking about omega-3s and the importance of them.
okay, have yourself a great day. Get out and enjoy this beautiful weather.